Hello, and welcome to the Nurture and Flow podcast. I'm your host, Andrea, and I'm a full spectrum doula here in Los Angeles. For the last 8 years, I've been supporting families have better birth experiences, even if we have to deviate from the plan. And today, you are smack in the middle of our series focused on partners. And what's our title? Birth Ready, a partner's guide to birth. Welcome back. This is episode 5 of season 1 of our podcast. We are almost done. There's only 2 more episodes left. If you haven't listened to the podcast before in this series, please do. It is really, truly focused on partners. Not only how you can support, but just how you can even show up for yourself, what it means to be a partner in this space and what it might mean for your pregnant partner. You just have the honor of being there. Today's episode, we're going to be talking about how partners can help identify common pregnancy warning signs. This is a big deal. Partners, I don't think, if you haven't listened to this series so far, go back and listen, because I think if you made it up to this point, you know how important your role is. It's so important. It's almost crucial in this process. You make a substantial impact on pregnancy. And this is just another piece of that puzzle to add to your toolbox, okay? I think one of the biggest misconceptions about partners is that they're just kind of an afterthought. They're just support, and you're the most amazing support. You're the one who knows your partner. You're the person that knows all the things, right? You're empowered by information. And if you weren't before, you definitely are now, because you're talking to me, your doula, or at least your virtual doula, not your official doula, but your virtual doula, right? And we've been getting resources, and today is no different. And so when we're thinking about the pregnancy journey overall, right? And I think people use journey in a weird way. I don't mean it in a hippy dippy way. I just mean it's a process, right? There's a start, there's a finish to the pregnancy, and there's a start to something else. And then there's a start to something else. And when we talk about warning signs, this is a part of the process. And although our title is talking about pregnancy, these warning signs are even more important to look out for in postpartum, okay? So recognizing early warning signs means you can quickly act, you can help prevent complications, ensuring a smoother pregnancy, and get ahead of things even if you're not sure, because it's better to be sure, right? We can only guess, so I'd rather you call me as your doula, or if you don't have a doula, you call into your healthcare provider and say, hey, I'm seeing these things, or we're seeing these things, and we're concerned, so that they can take a look at you and you're not having to guess, okay? It is not about being paranoid. It's not about freaking out. It is simply about being proactive and really caring about this process, right? When people talk about the pregnancy journey, I think a lot of times they forget that it's not some like whimsical roller coaster ride you're on. A lot of the things that we can do, be a part of, and feel involved in are moments like this, where we can kind of control some of the outcomes, right? It's worse when you don't know, or you don't know what questions to ask. And let me tell you, believe me, you're not going to know everything, and you don't need to. These warning signs that I'm going to give you next are probably the most common that flag healthcare providers, your doulas, your midwives to say, hey, maybe you need to get checked. Let's check on some things. Let's check off some boxes to make sure it's not this thing or that thing. But again, like I said, better to know than not. Okay. And while we're going into these, I'm sure there's other warning signs, and this list is not exhaustive. What I do see commonly, though, one of these 5 come up when there is a complication, and they also come up when they're not. But again, it's better to be sure. The first one we're going to talk about is severe headaches. So I'm not talking about, like, if your partner is prone to headaches, that's pretty common, right? But we're talking about this like sudden onslaught of headache. They're very intense. Sometimes they accompany with blurred vision. Um, uh, Rest or medication isn't, it's not helping it go away. It might even intensify, right? Um, this could really be a sign of high blood pressure or preeclampsia. Both are super vital for the pregnant person and their health. And by trying all those things, right, making sure the person's hydrated, that's number one. A lot of hydration. I have my cup right here, ready to go. Hydration cup, ready to go. Because I need to stay hydrated too, and I often forget. Your pregnant partner needs it way more than we do because their blood volume has gone up by 50%, and staying hydrated is a part of the game. It feels exhausting to stay hydrated, but staying rested much as you can, as telling your partner, not you necessarily, you should hydrate too, but hydration, rest, or medication. If none of those work, go to the hospital, okay? Call your provider, call your advice nurse, or make yourself available to go to the ER. Don't dawdle. I alluded to this a little bit as well, blurred vision. So sudden changes in vision, which I've seen often happen, might be an indication of like really being that stage of preeclampsia that's really dangerous, especially accompanied by a headache. It is absolutely important and imperative that you, again, call your provider, and are paying attention to that. Swelling. Now, swelling, although common, is not normal. Let me say that again. Swelling is common, but not normal. Here's what I mean. Pregnant folks tend to swell, especially if they're doing activities or they're on their feet for a really long period of time. That is normal, right? You sit down, you get home from a hike, you went to a park, you were out all day at a park, whatever, great. You come home, you sit down, say, hey, let's put your feet up. The swelling goes away. Great. The type of swelling that I really want you to pay attention to is the kind that sticks. We call it edema. It's the kind of swelling that's abnormal for the person's body type. It's a swelling that sticks, does not go away, that when you press it down, it also stays indented. These are all real signs, again, of not the kind of swelling that we ignore, but the swelling that we kind of say, hey, maybe we should get that checked and have really take a look at. We really see it in the face, the hands, and the feet. But it can also be around the whole body. Sometimes it can be like an immediate 36 pounds. This has happened to a client of mine. Like within a week's period, 36 pounds, they're super swollen. That is not normal. Uh, is actually a sign of something's wrong. It's preeclampsia sometimes. It can be nothing, but I'd rather you check and make sure. It can also be a circulation issue. We could have eaten too much salt. It's a whole number of things, but I'd rather eliminate the things that are actual complications versus, hey, maybe you need to hydrate, which also could happen here, okay? Severe abdominal pain. So this one gets a little tricky, but I'm going to help you out. When we're talking about severe abdominal pain, it's persistent, it's severe, it's a stabbing pain. So sometimes folks, out of just nervousness or maybe just not knowing, consider maybe a cramp because they haven't passed gas, or they actually need to go poop or sit in the toilet for a little while. Those kind of go away, right? But I'm talking about a pain that's just uncomfortable, right? Especially if it's accompanied by any type of spotting or bleeding. Do not pass go. Do not collect $200. Get yourself to the nearest hospital. It could be a sign of a couple of things, and here's the ones that we're really, really concerned about: is if the placenta has detached, especially if you're early in your pregnancy, actually any part of your pregnancy, even while in labor, there might be like spotting, but there should not be bleeding and there should not be stabbing pain. Contractions or surges are one thing. A stabbing pain, it is not the same. It does not give up. There is no relief. Go to the hospital, okay? Reduced fetal movement. Now, this is something that gets missed kind of pretty often because people just don't know to check. Well, I'm here to tell you fetal movement. Fetal movement, if you notice a decrease in fetal movement, you also want to contact your healthcare provider. It might mean that your baby is in distress. It does not mean that they are in distress necessarily. But again, we don't know until we're actually checking. And so the best way to do that is as babies further along in pregnancy. Let me back up a little bit. Once you hit around between 20 and 26 weeks, baby should be moving, unless the placenta for your baby is on the outside of the belly, like front facing. It's kind of harder to feel the kicks. Other places in the body, you definitely can. But again, if you don't feel them, it's important for you and your partner to really discuss that and discuss it with your healthcare provider. If you go from movement to not movement, flag, right? Now, babies go through sleep cycles just like us. Well, not just like us, but they go through sleep cycles. They're shorter, they're longer stints. But if getting up, drinking a juice, pushing your belly, poking the baby through the belly in a soft way doesn't get the baby moving, or you're just noticing just an overall decrease, go get it checked out. Again, none of these are meant to freak you out, more than make you aware of what you should be looking out for. If you stay ready, you gotta get ready, right? So these kind of do that. When we start thinking about even like some of the complications that come up, swelling comes to mind for me because we see it so often. We see it in movies. We see it, in our families. A pregnant person is, got their feet up because their feet are swollen or whatever. That's pretty normal. What's not normal is it sticking. So here's an example. One of my families last year, at their last prenatal with me, she was 6 weeks pregnant. And I've seen her before, obviously, so I know what she looks like. But I noticed her feet and ankles were so swollen, just out of the ordinary. And so I asked her, hey, how long have you been experiencing that? Oh, maybe in just the last couple of days, but I've also been moving around a lot. And I'm like, I think I want you to pay attention to that because that should be going down. I also asked her, could I touch her feet and her ankles? And I pressed, and she had a little bit of that sticking when you push down on the swelling and it like indented, right? That's always a flag for me. I said, you should probably get that checked. I'm a little worried about it. I've been moving around a lot. Well, she has been. She was nesting. But there's a difference, right? There's a little bit of swelling. You put your feet up, it goes away, but it would not go away over the last couple of days. Within the next 4 days, she was in active labor. She was 5 weeks early. And baby came on the 5th day. So baby came quick. Try to get the baby in for as long as possible. It's definitely close to full term. Baby is doing amazing. So that story isn't a negative story, but to tell you how quickly things can change when we don't pay attention to something as small as swelling. Again, look up even or talk with your doctor about examples of swelling you should look out for. They should be able to tell you that, and if not, we got to talk. You need to go back to a couple episodes because you are a part of the healthcare team, and you should know by now, leading up to this episode, what you should do if you're not getting the information you need from your healthcare providers. Let's see. I was going to give you another example. The abdominal pain. Yes, abdominal pain. So, maybe 3 years ago, laboring at home with another family, baby's full term, we're good to go. Wanted to labor at home for as long as possible. But during the contractions, at some point, she would have contractions, but was having a really sharp pain. And it just was not going away. She couldn't get comfortable, and then it started getting worse. So we decided, let's go to the hospital. Let's make sure she's okay, instead of just forcing laboring at home as long as we possibly can. Get to the hospital. Lo and behold, the placenta had partially detached. Um, she ended up having to have an emergency C-section. But following that information and us communicating, right, knowing what to communicate in that moment probably helped to save her life and her baby's life, right? Again, these are traumatic things that happen, but when you catch them early, it's not so much of a big deal. A baby might be a couple weeks early, but I'd rather that a healthy mom or healthy baby, and healthy parent than to say, oh, well, we coulda, shoulda, woulda. And that's going to come up anyway, especially once we start navigating transitioning from vaginal birth to cesarean birth or belly birth. But that to me is a better hill to climb than one that we just didn't pay attention to the things or we just didn't know. So I want you to know that these things are important. They're not just, oh, well, whatever, right? There is no might as well. Okay. As you're getting this information, I want you to also remember and thinking about the warning signs. As you're getting information from your doctors, what's the number one thing I tell you every time that I'll probably drill into your head until the end of this series, actually, probably every series, is the brain's framework. BRAIN, brain. Benefits, risks, alternatives. What does your intuition say? What if you do nothing? This framework is to help remind you to ask questions, to get clarification, and to be a proactive participant in your partner and baby's care. You are not being combative. Now, I go into detail about the brain's framework in a couple of episodes before in this series, so go back to that. I'll give you examples. But for our purposes, this is a practice to not only slow down the process, but slow down when you're scared. And if one of these signs come up and you're talking to a healthcare provider, or you and your partner are talking to your healthcare provider about your partner's symptoms, it's okay to take a beat. And this is a great way to do that. And just preface it like, I want to understand everything that we need to do. Okay. The other part that you can always be thinking about is paying attention to routines, changes, in routines or behaviors that you might see that might attribute to some of these minor physical changes and symptoms. That does not mean asking somebody how much they weigh all the time. That does not mean measuring someone. I really mean thoughtfully and carefully and compassionately paying attention to and checking in with your partner. Okay. Keeping a journal of the symptoms that you notice and for how long. It doesn't have to be a big deal. You don't need to get a new app. Go on your phone, type out your notes. This date, swelling. Swelling went down on this date. Okay, swelling hasn't stopped, call doctor. You should also be taking notes when you go see your provider, right? It might be annoying to somebody else, but this is your baby. This is your partner. You don't have to make excuses about you actually knowing what's going on. Imagine standing in a room and one of these symptoms come up and you don't know anything about it. You couldn't tell them from one way to another, and how isolating that might feel for you. You're standing off in the corner, your partner and their doula is talking, but you don't know anything that's going on with your partner. That can feel really isolating. And I think this is also a process of taking some ownership in some of this process. No, you're not carrying the baby. No, you can't birth the baby. That still does not mean you don't have a role to play. And looking out for warning signs, like, what is better than that? If you, like, I just gave you that example of me as a doula. Imagine you as a partner really showing up in a real way, and being compassionate enough and caring enough to say, hey, I'm noticing this and it's important. Here's what I know about the warning signs. Put them on this podcast. I'm sure it's only like 25, 30 minutes. Put it on, let them hear it too, so that you all can discuss it. Talk to your healthcare provider about what these mean, so you know what to look out for specifically, especially if you're a high risk patient, a high risk. This is a high risk pregnancy. Some of these things come up more often than not, and you might need to pay more attention to this. Okay. So the other part is effective communication and emotional support. So now you know what the common signs are. I gave you some examples of what that might be. We talked about the brains framework, but that effective communication, which we've talked about prior, and the emotional support go hand in hand here, because it can be sensitive to talk about someone looking swollen. It's touchy. It's touchy. But necessary, especially if you notice something long term. You don't always have to discuss everything, but I think having a regular cadence with your partner to talk about what's going on, especially if you work different schedules, you're busy with other kids, or you're caretaker for other people in your home, is good to just like find time to sit with your partner. And you'll find this really helpful again in postpartum, is really prioritizing time together to discuss how your partner's feeling. Has anything come up for them? Has anything come up for you? Because you're a part of this as well. A lot of this is practice. Truly, a lot of this is practice. So, as you know, you don't have to wait until something serious comes up. If your partner says, "Oh my God, I felt so dizzy today." Oh, what was that? What do you think that was? Well, what is uh a book say? Or what did the doctor say about that? Or is that something we should be concerned about? And a lot of times, no. Sometimes getting dizzy is part of it because someone's out of breath and the baby's taking up a whole lot of space and they sit up too quick. Sometimes it's a sign that they might need some medical care. We don't know until we ask, right? The emotional support part is based on really your relationship with your partner. But what I can tell you at the basis is having some empathy. There might be times where you're going to get nervous, you're going to get scared, you're going to see your partner be different, especially in labor and delivery, a lot less patient if that's their bag, or way more over the top if that's their bag. But understand it's not you. And it's really not about you more than it is about the experience. And you get to choose how you show up in that way. That does not mean you're supposed to take on any type of emotional abuse. However, there's a line and you have to toe that line, and so does your partner. And sometimes that might mean that you have to step away. You also have to provide yourself with emotional support. That does not mean taking advantage of it when things get tough. You're like, "Oh, I don't want to talk about this." No, if you don't want to talk about it right now, then you provide a time where you're ready to talk about it that is reasonable. And it can't be more than 48 hours. I'm going to tell you what my couples therapist told me, who is amazing. If you need to come back to a conversation, I strongly suggest, I don't want to talk about it, or you just cut that person off. No, I'm going to come back to you, and I need a break from this conversation. So I need to come back to you and have this conversation when I cool down, or let me go for a walk. I will be back in an hour. We can talk about it. Okay. Um, if you get into a little bit of an argument about you're too swollen for too long, and you're going back and forth, reassure them that you love them and you love their body. I'm worried about you because I love you. I'm not saying you're fat because that might come up, right? Also, don't say I'm not calling you fat unless they said that. just a tip for me. But it's a way to deliver these things. And it is sensitive and it's scary to be pregnant, and your body's changing and things feel uncertain and everything's in disarray. And so you, as an emotional support partner, you can really truly be so impactful in this moment. And again, it takes practice. You're not always going to do it right. And that's not the goal. The goal is that you keep showing up. Okay. And when you keep showing up, when you keep doing your best, this is when you get the opportunity to continue to monitor these common warning signs. Okay. Now, as we wrap up this episode, I kind of want to do a quick recap just so it's like really cemented in your mind. Severe headaches, severe, okay? Blurred vision, swelling that sticks, severe abdominal pain, especially if it's accompanied with bleeding, and reduced fetal movement. These are the warning signs that you're going to pay attention to, okay? And by paying attention to these, you become a participant in the care of your partner and your baby. Stay encouraged, Okay? You are not in this alone. It can feel like it sometimes, especially if you're the only person, or you hear other people's advice. Oh, my wife is crazy. Oh, my partner is crazy and I can't deal with them. They can deal with it. Or we just pass the buck, because sometimes that's easier. It's great if you have great if you have a team or a community to help, but that does not mean we just pass the buck. We do what we can with what we have so that we can show up at our best, not somebody else's best, not your doula's best, not your doctor's best, because you are not their doctor, their doula. You are their partner. And that in and of itself is a huge honor. So please do not misunderstand me when I say your role is so important. It can be frustrating. It can be tiring, but it doesn't have to be that all the time. Be encouraged. We are all we got. You will be all right. You will make it through. And with great communication, time, and practice, you'll feel much better. And guess what? You may not have to worry about any of these symptoms, but at least you knew. Well, y'all, that is my time this week. We are almost done with this series. I believe I have 2 more episodes in this series, so we'll have 7 episodes for this series. I think next up is, doesn't matter what's next up. We are wrapping up this series, and in 7 episodes, so it's all about you partners. I wanted to start this series with just partners in mind because I just thought it was important. Okay, I think we don't talk to partners enough. If you need any support, feel free to reach out. I'm available. I hope you enjoyed this time today. I hope you got some really great information. I'll put some resources in the show links just so you can click around and see what I'm talking about, read some medical information, some evidence-based information, and then maybe some midwife information around some of these common symptoms. In the meantime, of course, do all the things, rate the podcast, like it, share it, make a comment. If you would like to reach out, we'd love to hear from you, or I'd love to hear from you, excuse me. And you can email hi@nurtureandflow.com. Or you can visit me on all the socials, all the things, at Nurture and Flow Birth. And I will see you guys next time. Peace.